faces, see your names, see the number of folks joining get bigger and bigger. My name is Lisa Fujia-Parks. I'm with Prevention Institute. I sometimes forget to say that in my excitement of seeing folks who I'm excited to see. So we're going to get started in just a minute. Alyssa has just pasted in the chat a link to a spreadsheet. It would be awesome if you could hop into that link and just confirm your participation, your contact information, and if there's a web page or something you would like to share about your work, there's space to do that as well. We really are grateful for everyone's participation and want to keep track of that so that we can acknowledge and appreciate you all. So thanks for posting that, Alyssa. We'll give folks a minute to do that and also see if anyone else might be joining us today. So, and just in just a minute, I will just say a few words to kick us off. If you're having any trouble accessing the link or understanding what we're asking you to do, feel free to put that in the chat or come off mute and let us know. But I do see lots of Google animals, an axolotl, a camel. I don't even know how to pronounce the name of that animal, but more and more folks are joining that spreadsheet. So, and I hope you also enjoy getting a sense of who's participating today, or at least who has RSVP'd. And we're looking forward to interacting today and getting to know each other's work. And so welcome if you're just joining. Oh, okay. CDPH does not allow us to use Google through our system. Understood. Hi, Janine. Thank you so much for joining. I'm going to ask one of my colleagues, either maybe Amanda, if you don't mind, putting the questions in the chat. You could probably just direct message Janine or figuring out a way to include Janine without the use of the Google Docs. So thanks for that heads up. So welcome. I am so incredibly grateful for everyone's participation today. There are so many things going on in the world, and I'm sure there's so many things going on in your life, and all of you chose to spend this next hour or hour and a half with all of us. So I want to just warmly welcome you. Appreciate your participation. I'm going to really try to keep my comments to a minimum because I can go on and on, especially on the appreciations. I just wanted to say a little bit about how this session came about so folks have context, because this is a mixing of different people from different organizations in different contexts throughout California. So as I mentioned, my name is Lisa Fujia-Parks. I'm from Prevention Institute. And we have the honor of helping to steward a couple of projects. One is called Safety Through Connection. Another is called Leveraging Collaboration to End Domestic Violence. They're both focused on community-driven approaches to preventing domestic violence, promoting safety, and promoting equity. And we are gathering to learn together, also to do some planning for our future. But we heard that there were so many other folks throughout the state doing really great community-centered, community-driven work. And we wanted to learn from you. And we wanted to also open up the opportunity to hear from our folks to others as well. So through our longstanding partnership with CDPH and their amazing networks and our other partners like Valor and CPDV, we have a really nice diversity of folks who participate in different networks joining today. So really grateful for that. And if you have any questions about why am I here, what is this about, feel free to let us know. But just want to communicate our appreciation for the coming together of a network of networks, or really kind of seeing those boundaries of, okay, you participate in that project or that organization, seeing them as overlapping and really trying to appreciate this amazing statewide ecosystem of prevention advocates that we have in California. So without further ado, handing it over to my colleague, Alyssa, who will help orient us and get us started. So thank you, Alyssa.
Well, thank you, Lisa. Well, it's great to see everyone here today. So I'm just going to go through just a brief description of our session today. So we built out this session with the understanding that community members are really important to preventing domestic violence and also supporting safe relationships within their community. And so sometimes the role communities members might take looks like being a community organizer, an ambassador, a health worker, or even an advocate. And so just given their proximity to the community, they're able to design and implement strategies by and for their communities, which might look like peer outreach or participation in budget advocacy campaigns. So with this session, we've been inspired by appreciative inquiry, and the session will be broken down into 3 main parts. So we have here Discover, where we'll hear from our Safety Through Connection and Leveraging Collaborative to End Domestic Violence collaboratives, and guests share out their current work with community health workers and organizers. And then in Dream, my colleague Amanda is going to share about ongoing efforts happening within the state and out of state to support community organizers and health workers. So for those first 2 portions, that will be in about an hour, and that will be just a learning session together for everyone. And then with the last part, design, that will specifically be for the 8 collaboratives currently working with Prevention Institute. So we encourage you to, when you're speaking out loud, to also share out your collaborative and your organization name so we get to know one another. So I will pass it on to Lisa now.
Thanks, Alyssa. My apologies. We weren't aware that there was going to be a need for simultaneous interpretation today. Apologies on our part if that was a misstep, a miscommunication on our part, but we do not have any simultaneous interpretation today. Would be happy to connect after the session to kind of debrief what might have gone awry, but our apologies, that's not something we have available today. But glad you were there, glad you were here, and I'll be able to chat more through the chat in just a minute. Great. So we're gonna launch right into, well, let me just pause to see what else is coming up in the chat and if anyone has any other questions or issues coming up. Okay, please do let us know if you have any questions. And but thanks for that orientation to our purpose today and our what we're about to do. So yeah, this first section, so we're leaning into appreciative inquiry. This first 30 minutes is really about discovery. So we're going to hear from Safety Through Connection and Leveraging Collaboration to End Domestic Violence collaboratives and some other guests about their current efforts related to community health workers, educators, organizers, and so on. So this is a really informal peer-to-peer sharing. And passing it back to you, Alyssa.
Thanks, Lisa. So, so we have some great guests that are going to speak about, just give a high-level summary of their work. And they're going to be specifically responding to 2 questions, which I'll post in the chat. But I guess with our first up will be Erica Villa from Nextdoor Solutions, and then Leticia Olvera from El Sol Neighborhood Center, Natalie Olias from Contra Costa Family Justice Center, Robin Baker from McKinleyville Family Resource Center, and then Deglis Delgado from Cultiva La Salud.
Awesome. So I think we are ready to hear from Erica if you're here. I also will have a little 3-minute timer just to keep us on track. I know that we have a lot to cover today and a lot that we want to hear from folks. So just in that spirit of brevity and wanting to hear from as many folks as possible, I'll have a little timer, but yeah, we welcome you, Erica, to share whenever you're ready.
Okay, I wasn't sure. Hi, everyone. So my name is Erica Villa. I'm from representing Next Door Solutions to Domestic Violence. So we are actually located in the Bay Area in San Jose, California, and we're the only standalone domestic violence agency. So we've been in service for about 50 years. So we actually, the way we ventured off into this journey about working with community health workers, it wasn't really intentional. But it actually started, we did a call out in our support groups. So we offer support groups for survivors of domestic violence. And so we did a call out because we actually wanted to create a survivor advisory board. And so we did this in 2017. And we've had a group of women that started our survivor advisory board, but we actually realized that they wanted to be part of that advocacy and be part of educating the community. So, and we wanted it to be led by them. And so they actually, their goal is to educate and inform the community about domestic violence, to raise awareness, and to also address gaps in services within our agency and within our systems, and identify those gaps and let us know what those gaps are, what they're hearing from the community. And so they were doing a lot of outreach education, presentations out in the community. And then once the pandemic hit, that's when kind of like their work was at pause because they would do it in person. So this group is monolingual Spanish speaking. And so we were on the point to expand and open that group right before the pandemic hit. And while at the same time, we were actually working with Stanford on different areas of work. And so when the pandemic hit, Stanford actually, our partners at Stanford reached out and said, hey, what can we do to support? And so at the same time, our, and they're known as El Comité de Mujeres Fuertes. And so now we've even changed their title because we have a male participant. And so they identify themselves as survivors, but also community health workers and allies raising awareness on domestic violence. And so they also wanted to do something. They were like, we're seeing these needs in the community and we want to educate, especially when we were in shelter in place. We knew that particular groups were very isolated. And so they're like, we need to educate other community health workers, other promotores groups about the intersectionality between COVID and intimate partner violence. And so that's where we actually connected them with our Stanford partners, and we created this train of trainers for other community health workers. So our group of El Comité de Mujeres Fuertes actually went to a train of trainers through Stanford and got trained to develop this train of trainers for other promotores groups, community health worker groups. And so once that got finalized, we actually also partnered up with our public health department because they were the ones that were more closely working with grassroots community health worker groups to raise awareness around COVID, like, wearing masks and things like that. And so we also were interested in creating this learning collaborative of community health workers, and share our learnings and share that intersectionality with intimate partner violence and other sectors, not just COVID. And so we are actually in the process of restarting this learning collaborative. So with the help, convening with the help of public health. So we're going to start planning that out. But so our community health workers do identify as survivors, but also don't want that to be the focus, like sharing the stories of what victimization or what they went through. But they want to share like the resiliency. And so that's been the focus, and also educating others in the community, and in particular, other community health workers, so that they also spread the word of where to get services and access to services and learn from each other. So we are in the process of creating that shared exchange of information through a learning collaborative of community health workers. If that makes sense. I hope I'm within the 3-minute.
Yeah, thank you so much for sharing. I think some really interesting insights that you brought. So just we'll move on to Leticia Olvera from El Sol. And again, I'll have the timer on if that helps with keeping pace.
Okay, hi, thank you. Leticia Olvera from El Sol Neighborhood Educational Center. So basically, to answer one of the questions, we as promotoras, we are advocates, we do outreach, we basically cover all the titles that you guys put on the questions. And what we do is outreach door to door to spread the message around. And with this program, Domestic Violence Prevention, we are advocating for healthy relationships. We are not focusing on the problem, but we are focusing on the prevention part. So instead of talking about all that kind of violence, we're talking about how can we get along to each other with healthy words or healthy phrases. We develop an infographic also. Well, the group did it. So this is for education to the community. We also have a bookmark, a brochure, and in those brochures and the bookmarks, there are a lot of phrases, healthy phrases that they develop, the group developed. We have an intergenerational group, and those participants are not from any other organizations. They are from the community. So also we did a video, and what is your role? Because we as a group, we know and we understand that everybody has a role in domestic violence prevention. And our other mode is everybody has a voice. So if you see that something is happening, you have to stand up. You cannot be quiet. When you see somebody bullying another person, you have to stand up. So one of the things that we are working on is empowering the group. So that way, when they go to their families, to the store, anywhere they are talking about our program, about how we can prevent domestic violence. And they are giving everybody the information. We did a car parade. We did a bicycle ride parade also. And we are planning on doing a march in the city that we are working on it. So we are kind of in the planning of doing everything. And this is thanks to the Close to Home program, which is leading us and is guiding us on how to work with the community and how to make a difference and go and talk to the congressman, to the assemblyman, because we need a lot of allies in this movement. This is a big movement that we are trying to have here in the Valley.
Thank you so much. I think really interesting to hear about all the awareness that you're bringing. So next we'll move to Natalie from the Contra Costa Family Justice Center.
Hi, everyone. Natalie Olias with the Family Justice Center. We work with survivors of interpersonal violence. And so one of the ways that we try and incorporate community advocates as much as possible is through our program called Community Fellows. So I would rank them closest to a community advocate, but they're actually our community fellows. They are survivors of interpersonal violence, majority of them being survivors of domestic violence specifically, and have they've already gone through their crisis. So they've been able to get assisted with, legal, everything else, and are now in a state where they want to be a part of the center, raise awareness, but also grow in their own leadership skills. And so we have a program, it's a sort of like a leadership program that we run at least once a year called our Community Fellows. And they're survivors that are able to join in a leadership program that helps them develop leadership skills, whether it's, public speaking or whether it's community organizing, whatever they want. And during that program, not only do they learn the skills, but then they create their own project. And the project somehow relates to the work of the Family Justice Center. So for an example of that, one of our community fellows, who's actually now a staff member here at the Family Justice Center, in 2015 created something called Project Connect. And so what she was noticing was that her community, the Latinx community, was really isolated from one another. And so she created a program where it was a once-a-month get together, learn about different resources. It wasn't a therapy group or anything like that, but just learn about resources, connect with one another. And so that's been running since 2015 at our centers. And most recently, Project Connect actually, we are able to offer it in both English and Spanish, and it's throughout our 3 centers in Contra Costa County. So that was her project. It was a way of bringing folks in, making them feel like they had a sense of community and support where that may have been taken away from them at some point. Thank you.
A bit about their programs.
Thanks. Hi, everyone. I'm Robin Baker. My pronouns are she, her, and I'm an interim co-executive director at McKinleyville Family Resource Center in Humboldt County. I work alongside Aristea Salisbury, who some of you may know. In addition to this role, I'm managing our guaranteed income pilot program that will serve pregnant and parenting folks in our community and co-coaching one of the leadership programs that I'll be talking about today. I grew up in a home where intimate partner violence was present and have experienced intimate partner violence myself. And I share this to say that we know we can't separate those doing prevention work from those who are receiving services or participating in healing. And this is something that we hold central to the leadership development work that we do. We consider our community health worker support to be community members as leaders and educators. We bring cohorts together around community-driven issues or shared identities. For example, right now we have 3 cohorts. One is a representation of all 4 partner agencies here at the center, including Department of Health and Human Services, Child Support, our local federally qualified health clinic, and Family Resource Center staff. Another is youth ages 21 to 26 who are BIPOC, queer, or disabled. And this group is coming together around substance use prevention. And then finally, we have a BIPOC teen cohort that brings together teens from 2 local high schools. Last year's cohort created the Equity, Equality, and Leadership Club, or EEL Club. This is the logo that they made, and that'll be starting on 2 campuses in the fall. In the future, we're planning to have cohorts focused on BIPOC adults in this work, and then also bilingual practice. A core tenet of the program is, in order to do great things in this world, you must be known and know others. Cohorts connect around shared vulnerabilities, healing in community, and project-based work. And through participation, they're able to heal together, better know themselves, and be sustained in what we all know can be very difficult work at times. Thank you.
Awesome. Thank you so much. Love the logo. And we'll move on to our last share for this section, which will be Deglis from Cultiva La Salud.
Hey, good afternoon, everyone. My name is Deglis Salgado, and I work with Cultiva La Salud as a project coordinator of Mujeres Poderosas Amorosas. And yeah, I just want to share the Cultiva La Salud, as part of the COVID response, was able to hire 2 of the Mujeres Poderosas Amorosas back in 2020 as CHW, or community health workers. They were able to assist people with IQS, or isolation and quarantine support, and COVID testing events, and eventually educating people about COVID vaccine. Cultiva La Salud still uses this model to connect people with resources, and they also do home visitation, which creates spaces to build close relationship with the people that they serve. In the same line, Mujeres Poderosas Amorosas is using the same kind of like type of model to identify ladies in each community that we serve. We currently serve in 4 communities in the Fresno County, which is Parlier, Ridley, Orange Cove, and Fresno, and the city of Fresno. And we have identified 1 person in each community to serve as a kind of like a connector. And one of the things that they don't identify as survivor, but they're more like a community leaders with the heart to help people and improve their community. They work as big sisters, sometimes aunts, for people who need it, and it's just beautiful. They have gone through some type of trainings to be able to do such a work. I have to say that this is kind of like a volunteer work, which we appreciate, and we, in so many ways, want to honor them. But this is basically what we're doing. Cultiva la Salud back in 2020 was part of a coalition of 6 organizations. Now it's more like just one kind of like umbrella, and Cultiva la Salud is one of is part of this umbrella. There's this model, the CHW, is still going on, and it's basically they're doing like home visitation and yeah, mostly like I will call it connectors, because they connect people with different type of resources and stuff. It's very broad, and it's very beautiful what's going on and what's happening through the CHW, and also with our Mujeres Poderosas Amorosas, who serve as community leaders in their own community. So thank you for listening.
Great to hear about both kind of the community health workers and the leaders and the different types of roles that folks are taking on. So I'll pass it back over to my colleague, Alyssa, for this next bit.
Thanks, Amanda. So we acknowledge that we've only heard from a few groups out of the many amazing stakeholders that are present with us, but we are invested in hearing about your work. So we'll have a follow-up email with a Google form for you to share out more about your work. But in the meantime, feel free to drop in the chat how you involve community workers throughout your work. And so I'm going to quickly pivot into
Alyssa, I think we have some time to hear from folks if folks want to unmute and share about their work, I think. Sorry if that was not the plan, but I thought we were going to open it up for people to share if they wanted to come off mute or put it in the chat.
Probably someone our organization can go. I don't know if Fatima or Reem want to go.
I was gonna ask also if we have a small PowerPoint that shows our work, and a video and a song, but I don't know. I know with 3 minutes, we didn't even put the PowerPoint or anything, but it shows exactly what the promotoras do.
Yeah, I can share a little bit about how, answering the question of how we characterize our community health workers. My name is Reem Zubeidi. I work with the San Diego Refugee Communities Coalition. And, our community health workers became, we kind of got kickstarted through COVID and like reacting to the immediate need. And through that, it's really, we've been able to expand services so much because I think, as somebody mentioned before me, that seeing the intersectionality of like the issues that come out that have been highlighted through COVID, that have, been pre-existing and have been exacerbated through the pandemic. And so our community health workers really, like, I would categorize them across all of these, the strategies that are mentioned here, they're community leaders. They kind of rise to the needs that we're seeing. So, because they're from the communities that they represent, they are, speaking those languages. They're, we represent a coalition of 12 different organizations. So each of them has a very diverse population that they're working with, and they are the experts in their communities. So, with organizing this workforce of frontline staff, we're able to see, a very strong feedback loop that advises what our next steps are, what are our priorities as a coalition, and we're much more intentional. We're able to be much more intentional about how we pivot and the roles that our community health workers are playing within the community. So with that, it's like, you know, our community health workers are leaders within their communities, they're advocates, they're organizers, they're kind of playing multiple roles across all of these things. And we have a few of them here today. So it's great to be talking about this.
Yeah, and I'll add on to what Reem was saying. Thank you, Reem. But basically, the work that started off with the coalition was, you know, they started off with the COVID, and you know, the vaccine was something that was brand new. It was something that the community hadn't been exposed to. There was a lot of like myths and superstitions. So, being trusted messengers and community members, they had that trust already. So they were working on, you know, speaking the language that the community members are speaking, and shedding light on like vaccinations, eligibility, and they were working on COVID therapeutics. But you know, after, you know, obviously the federal declarations ended regarding COVID, but it's kind of shifting over, and the community and also the state is realizing this is something that needs to stay, and you know, this kind of program is definitely necessary and needed. So it's just kind of shifting over into other areas of need, you know, whether it's housing, school support, whether, you know, interpretation or translation. RCHWs, we have a few of them on the line here today too, and they can share if necessary, and if we have time, but they're there, you know, to shed light and help wherever they can. So it's something that we've been doing for a while. And, you know, one of the great things is that the CHWs are very adaptable. You know, if they're going in with an idea or a plan into an appointment, or they're meeting community members that they've never met for the first time, they're there for them to help them with whatever's needed. So, you know, you may not be a therapist, but how can I help you? How can I, you know, get you over to the resources that you need? But yeah, if anyone else that's on the line from our team wants to share, take the.
I'm
Thank you,
sorry,
Fatima, for
Fatima, I'm
sharing.
sorry. Unfortunately, I don't think we're gonna have time.
Oh, okay.
Yeah, but please go ahead. Please, just if you can keep it brief, that would be great.
Yeah, I just wanted to thank Fatima for going. She touched upon majority of the things that we do at UEast. And one thing I do like about UEast and the SDRCC is that they appoint individuals in the community who are very well known, because with some of our immigrants, they feel kind of shy and kind of scared of seeing other people. But for them, seeing individuals in their community who look like them, helping them with whether it's COVID or housing, things like that, it kind of breaks like the bridge between us and other community health workers, and that lets them know that, hey, that we're here for them and things like that.
Thank you, Zach, for sharing, and thank you to Fatima and Reem and Letitia and Laura for sharing. But just for the sake of time, we're going to pivot into Amanda's section, where she'll be talking more about the efforts going on to support community health workers within the state and also out of the state.
Cool. Awesome. Thank you, Alyssa. So again, great to hear from everyone. So I'll bring us into our second section, which is our dream section, where I'll start by sharing a little bit of information just to ground us and get us on some shared language about the values and roles and ways of engaging community health workers and workers more generally. And then we'll hear about some efforts that are going on to support these folks across California and hear from each other about what we might be interested in building together in the coming years, taking into account our SDC and LCDV collaboratives who are here, as well as our interests as a group. So to start off, I know a lot of you might be familiar with the next two slides I'm about to share, but wanted to share some values and characteristics. And this has been adapted from Visión y Compromiso's Promotoras model. And we find that it's consistent with a lot of how we have been talking about what community workers are doing, and also I think based on what you all are sharing today. So just to go through these in brief, community health workers and organizers, educators, advocates, they're all building relationships with the community they work with based on trust and understanding and the sense of mutual respect. They're really focused on approaching the community with empathy and compassion, and really importantly, they're members of the community where they live, right? And I think that's come up a few times. They have similar life experiences, they have a desire to serve, they have a unique knowledge of the cultural traditions and the language of the people they're working with that doesn't exist in other types of roles the same way. And they also serve as a two-way bridge between the institutions that exist and the community residents themselves. So they're helping bridge those barriers of language or fear or differences in how to navigate the systems, and they're bringing information to the institutions as well about what community members are needing and helping to shape and improve outcomes that way. And then finally, they're really involved as advocates committed to social justice and role models for change. So I think we're seeing that a lot of you are already engaging folks that align with a lot of these values. We just wanted to share as something to continue to think about. And then want to briefly touch on the 10 core roles of community health workers as well as defined by the C3 project. So y'all might be familiar, but the C3 or CHW Core Consensus Project really laid out a national definition of what community health workers' skills and roles and qualities are. And although this is specific to community health workers, and we're hearing folks today sharing kind of different terms or ways of understanding what their folks are doing, I think it shows that it's a really broad list of roles that community health workers can take on that encompass, education and organizing and advocacy. So just to walk through these as well briefly. Community health workers are cultural mediators between individuals and communities and health and social service systems, right? So they're working with these systems to build more culturally appropriate services and models for care. They're providing culturally appropriate health education and information. Our community health workers are involved in care coordination and helping folks navigate the health system. They're involved in providing coaching and social support for individuals and families and communities. And they're advocates. They're advocates for individuals, for community members, and bringing attention to the needs of the community to government, health systems, policymakers, other institutions. They are building individual and community capacity by helping folks realize the potential that they have and be able to act on that. They're often involved in direct service. So I think a lot of you mentioned, or a few of you mentioned COVID earlier, COVID response. So that could be an example, or like blood pressure screenings, first aid, all sorts of those kind of healthcare direct service related activities. Community health workers are also often and should be involved in community assessments and individual assessments. So conducting needs assessments with a public health perspective, conducting windshield assessments to see what community assets are there and what needs to be done. Our CHWs can play a really great role in that. And they're often doing outreach, and then finally should be involved in more of and already are taking part in evaluation and research of their services. So that can include, learning the skills to do evaluation and research of their own activities, which we've seen in many different parts of the country, and then also learning to bring in community members into the research space to help do more community-based participatory research. And then on the next slide, I want to share some principles that have emerged as we've been in conversation with folks about how to engage community health workers and organizers in the work. I think these are just a few things that rise and come up for us, but I welcome you to share anything that you think is an important principle or value in the chat as well. So the first one is equity. I think all of us here would agree that equity is something that we need as an outcome for our communities, but also importantly, we want to think about equity infused in the process, right? So as we're training folks, hiring them, designing programs, implementing these programs, we want to think about how we can create equity for the health workers themselves and for organizers, create equitable processes for them. I want to think about racial justice. I think we'd agree that this is all a really necessary lens, given the role that community workers are often playing with BIPOC individuals and with marginalized communities. Really centering and elevating racial justice is so critical. And then lastly, kind of community leadership and power sharing is also so important. We know that community workers bring a very valuable and needed perspective, but oftentimes they don't have a seat at the table, and that's very unfortunate and should not be the case. And so building avenues for community workers to participate in decision-making about their workforce and the community as a whole is really important, as well as we're starting to think about how to engage these folks. And then the next slide here, I have just a couple continuing on with like best practices for building initiatives that have emerged from our conversations and research as well. But again, I invite you to share anything that you feel is a best practice that you've noticed in your own work has been something that's been really important. So the first here is preserving and elevating health workers' role as someone in the community, first and foremost, like recognizing that they have that unique understanding, and then being able to embrace and really advocate for a full scope of work for them, given that they have such unique knowledge and skills. The second is enhancing training for both employers and community workers to support more systems change activities. So we recognize that there are a variety and kind of patchwork of different credentialing programs, training opportunities that are out there. And sometimes this means that folks with really unique community knowledge are left out of employment opportunities. So something that, as we start to think about how to build initiatives, is really important, is also being able to think about how to build internal training programs and partnerships to help build skills for both the employers to support the workers the best way possible, and then also for community workers themselves. And then lastly, something that I think is top of mind for everyone definitely is sustainability. So seeking long-term sustainability in funding streams, as well as building partnerships and alliances across organizations and systems, can be so important. We know that initiatives like this sometimes just don't have the most stability in terms of employment opportunities for folks. And so being strategic about those long-term and internal sustainability efforts can be great. Cool. So kind of now that we're all kind of on the same page with some of these ideas, I also want to talk a bit about opportunities and key stakeholders. And I welcome you to, towards the end of this, to share what opportunities you're aware of. So we wanted to highlight the Community Health Worker Promotoras and Representative Coalition that's going on in the state of California. We know that for some of you, you might be coming to this work and want to learn more about policy opportunities or just what's going on. And so this coalition does a lot of advocacy work. They also have a meeting next Wednesday where they'll be talking about their policy agenda that they've put together. So Alyssa put a link in the chat for you to go and read about that. We also want to recognize a couple great organizations, CPEN, or the California Pan-Ethnic Health Network, Visión y Compromiso, that does great work with promotoras across California and Mexico and nationally. And then El Sol, who so lucky to have some of you folks here with us today who are such great leaders in training and supporting community health workers and promotoras. So these are just some of the organizations that we encourage you to look towards if you're interested in learning more or just learning what's out there. And then lastly, we want to reference that California has made a lot of commitments to support the workforce. I think there's been increased funding for hiring and training and a commitment to train many more community health workers by 2025. And despite kind of budget deficits and other challenges within the state, there has been somewhat of a commitment from legislators to see this through. So I think that's a really positive thing. And then there's been recent legislation, not so much this year, but more in the recent years, to support and reform Medi-Cal benefits to be able to reimburse for activities. So we see this as an important opportunity and point in time to be engaging community workers and organizers of all types, and a great opportunity to do more. So I do want to open it up for a few minutes, either in chat or out loud, for you to share opportunities that you might know about. So whether that's organizations you want to mention, maybe partnership opportunities, grants that are out there, specific domestic violence related opportunities in this space. Really want to see what other folks know about and want to highlight. And I can also, I think, feel free to continue to share opportunities in chat as you come to think of them. I think we can also move on to our next larger discussion to close out this first hour of our time together. So yeah, so we just have two discussion questions for you all. The first one being like, what's something that you've learned about today that you're excited to apply to your own work? And then the second being that given that there are so many community worker related projects related to domestic violence that are going on, just from our partners that are here today, what's an opportunity or an idea for us to support each other across communities? So Alyssa's putting these questions in the chat for us, and then I'll also just stop screen sharing so we can have more of a discussion for the last 10 minutes or so of this first hour.
I can answer the second question.
Okay, yeah.
Hello everyone. My name is Kobe. I'm with United Women's of East Africa Support Team. We're located in San Diego, California. So I'm kind of familiar with some faces, but some faces I don't know. So nice meeting you guys. Yeah, so the second question, can you go back to it's in the chat, right? So my thing is like, I feel like if we all could connect and like, I don't know if we could do like these meetings, maybe like once a month or like, it doesn't matter. It doesn't have to be like frequently, but if we could get to like know each other and connect, I feel like we could do like get some ideas and brainstorm from each other, because just hearing everybody speak today, that aligns with the work that we're doing here at UWE. So just connecting with others, I feel like could build like a stronger community for us, and as well as like we can learn from everyone else that's speaking, and we could give some of our knowledge to others that are willing to get that information. But yeah, definitely if we could connect and get to know each other a little bit more, that would be great. Thank you.
I'll go ahead. I think what I learned today and that is exciting is that a lot of us are doing some really great work. And so I think what would be great is, just piggyback on what Kobe said, if we could have like a learning collective where we can share, best practices or what everyone's doing. And that's something similar that we did with the Learning Collaborative, or that's the intention, to kind of create an asset map of community health worker groups within our area, so that we learn what each other's strengths are and weaknesses, well, not weaknesses, but areas of learning, so that we can share and learn from each other. And so that was the intention there. So if we do it at, at a bigger level between organizations, I think that would also be great.
I think I would love to connect with you, Erika, just so that I have questions about how you all went about creating the advisory board, because I think that can be replicated for like many different types of collaboratives. And I'm in the Bay Area as well, and I'm a big fan of Nextdoor Solutions because I practiced in Santa Clara for a while.
Awesome. I'll put my contact in the chat.
I would like to say on question number 2, what our group would like to see is like maybe investing more money on spots on TV and maybe on radio, like examples on how you can have a healthy relationship, because we usually see the problems but not the solution. And this is an example of a couple. They are my friends, and I asked them, how come you guys get along so well and help each other and you guys are a team? And then he said, my friend said, it's because we saw my brother and his wife, the way they get along, and me and my wife, we thought it is possible. we can get along, we can have a healthy relationship. So thinking that way, maybe our community or they don't have that kind of examples in their lives. They just, all they see is violence, because by culture or whatever, we are used to treat each other with bad words and this and that. So that's all they learn. We are programmed to do that. But then if we see something different, maybe we are going to think, oh, I like that. I want to live that kind of life. So I don't know if we could invest more money on that, on that kind of relationship, maybe comics or maybe a cartoon showing how when the husband gets home and then the wife, how are you, how was work, and instead of giving him problems, and vice versa, the husband is, how can I help you, or we're a team, we can work together. And I don't know, things like that, change the culture if necessary. Thank you.
Just to add on the importance of why this would be actually very beneficial, I just want to add on of things that we have been doing. So we have actually been doing a collaboration between youth and adults in educating the Latin American community about domestic violence prevention. And we have provided an amount of resources such as where to get help, who to call, and all those things that have become very beneficial in the community. And this intergenerational partnership creates a dynamic environment for learning and empowerment as youth and adults contribute their unique perspectives and experiences. And the youth-led initiatives have a powerful influence on their peers, allowing them to find relatable stories and actually be more than impactful in their messaging and how they're voicing themselves. And the combination of adult expertise and youth innovation ensures a comprehensive understanding of the issue. And, you know, this can actually be helpful along with what Leticia was going with the videos that we can provide a series of trying to provide healthy relationships and trying to project that. So the joint efforts also increases outreach through diverse communication channels, fostering community engagement and awareness. And as we create that, it creates this empowerment that it helps us to work a little bit more efficiently so that we can unnormalize violence. So that's all I wanted to say. Thank you so much for listening.
Thank you, everyone. Any other thoughts on any of the two discussion questions? Make sure to leave time for any folks who are still interested in sharing.
I think if there's a way to support collaborations, I just shared in the chat the videos that we created in partnership with Stanford. And so collaborating with universities in your area definitely opens up the segue to be able to create, you know, those videos that we're talking about, or PSAs, because of our partnership, you know, with Stanford, because Stanford is very well known. That opened the doors for us to get funding to support that, specifically those PSAs, which I'm just realizing we need to figure out a way to promote more of that, of what we do. So definitely agree with funding to be able to promote, you know, the positiveness, the protective factors on what constitutes a healthy relationship, either in radio stations, commercials and things like that, because that was one of the things that we didn't realize until afterwards, that we didn't have funding to be able to promote those PSAs out in public.
Sorry, Lisa.
Yeah, go ahead.
Yeah, no, briefly, I just want to share my experience as a CHW, like back in 2012, I think. And yeah, I wish there were more trainings about specifically for CHW. People are entrusting us their life. They're entrusting us in their life, in their house, in their kids, like allowing us to go in. For those of us who, besides CHW, do home visitation as well. I just wish there were more trainings just about domestic violence preventions or looking the signs of domestic violence and being able to be more helpful in those cases. And I actually this kind of like raised one question for the CHW and Cultiva la Salud. I just want to ask them like, hey, what do you guys do? Do you refer people? Do you know where to refer people when you see this type of signs, or what do you do for prevention? So just curious about that and advocating for those type of trainings for CHW. So
Yeah, thank you for sharing. I think we've heard from everyone about kind of a need for training, for creative partnerships, for promoting the work and really bringing attention to it through different channels. So thanks all for bringing those points up. And I'll pass it over to Lisa for Alyssa for a quick announcement about our next steps.
Great, thanks, Amanda. So we'll be actually moving on to the design portion of our presentation. So we will ask that all 8 collaboratives that currently work with Prevention Institute to stay on. But for everyone else, we want to give you a huge thank you for joining us and for sharing about your work and asking questions and just engaging deeply with our content. So we welcome you to keep in touch with us. And also we look forward to connecting with you again sometime soon. So thank you again.
Thank you. Bye.
Hey, well, thanks for staying on. And there's some names that I don't recognize. We don't need to, I don't think there's any
Okay.
slides to share. Is there?
Okay, gotcha. No, I think we're
Okay.
good.
Yeah.
One quick question. Do we want to pause the recording? Because I know we might want to pursue interpretation of it and maybe leave out this section, or do we want to keep?
Yeah.